Most people think a heart attack feels like a lightning bolt, a crushing weight on the chest that drops you to your knees in the middle of a stressful day. But as someone who has spent over 30 years in the ER and private cardiology clinics, I'm here to tell you that's a dangerous myth. For many of you watching right now, especially if you're over the age of 55, the real danger isn't lurking in a stressful board meeting. It's waiting for you the moment you swing your legs out of bed at 7 a.m. Let me tell you about George. George was 68, a retired high school principal. He lived for his morning routine: 2 slices of toast, a large cup of coffee, and a quick walk to the mailbox. He felt fine. He told me during his yearly physical, "Dr. Hayes, I'm just getting a little slower because I'm nearing 70. It's just old age." 3 weeks later, George's wife called me from the ICU. George hadn't just been getting old. He had been ignoring 3 specific morning warning signs that his heart was gasping for help. Today, I'm going to pull back the curtain on what your standard 10-minute doctor's visit misses. I'm going to show you why millions of American seniors are walking into a cardiac trap every single morning. And more importantly, how you can stop it today. When I see swelling in a patient's lower legs, I hear the same thing every time. "Dr. Hayes, I think my shoes are just getting too tight." Or, "I've been standing too much while gardening." They think it's a skin issue or a footwear issue. But this isn't about your shoes. This is what we call peripheral edema. When your heart muscle begins to weaken, even slightly, it loses the ability to pump blood back up from your extremities against the force of gravity. Fluid begins to leak out of your blood vessels and settles into the soft tissue of your ankles and calves. If you wake up and see sock lines deeply indented in your skin, your heart is struggling to manage your body's fluid volume. Think of your circulatory system like the plumbing in a 2-story house. Your heart is the main pump in the basement. When that pump starts to rust and lose power, the water can't make it to the top floor. Instead, it starts to pool and flood the basement floor. Your ankles are that basement. That swelling is the floodwater of your cardiovascular system. According to the American Heart Association, edema is one of the silent early markers of congestive heart failure. Nearly 6 million Americans live with heart failure, and many don't realize that morning leg heaviness is the first SOS signal the body sends out. Perform the thumb press test every morning before you put on your socks. Press your thumb firmly into the bone of your inner ankle for 5 seconds. If a dimple remains for more than 3 seconds after you let go, your heart is likely overworked. Today, start reducing your sodium intake to under 1,500 milligrams and call your doctor for a simple BNP blood test. The next thing I hear often is, "I just got up too fast, doc. I've always been a little lightheaded in the morning. I just need my coffee to get the blood flowing." This is often orthostatic hypotension, but for seniors, it's more sinister. It indicates that your baroreceptors, the sensors in your neck that tell your heart to beat faster when you stand up, are failing. More importantly, it can be a sign of a stiffening aortic valve. If that valve is narrow, your brain is literally being starved of oxygen for those first few seconds of the day. Imagine a garden hose with a heavy kink in it. You turn the faucet on full blast, but only a trickle comes out the other end. When you stand up, your brain is demanding a gush of blood. If your heart or valves are kinked by age or plaque, the brain doesn't get what it needs, and the lights flicker. That's your dizziness. The CDC reports that falls are the leading cause of injury-related death among adults aged 65 and older. A massive percentage of these falls happen in the bedroom or bathroom during the first 30 minutes of waking up due to these undiagnosed blood pressure drops. Adopt the 1-minute sit. When you wake up, do not jump out of bed. Sit on the edge of the mattress with your feet dangling for exactly 60 seconds. This allows your heart to recalibrate its pressure before you gravity load your system. Then there is the issue of what you eat. Patients say, "I eat a healthy breakfast, Dr. Hayes. I have a bowl of bran flakes, some orange juice, and a piece of whole wheat toast." This is what I call the glucose grenade. Most healthy cereals and juices are loaded with hidden sugars and processed carbs. In the morning, your cortisol levels are already high to help you wake up. Adding a massive sugar spike causes endothelial dysfunction. This means the inner lining of your arteries becomes inflamed and sticky, making it the perfect Velcro for cholesterol to attach to. Imagine your blood vessels are like smooth, silk-lined tunnels. When you dump that sugar and processed flour into your system first thing in the morning, it's like throwing handfuls of jagged shards of glass through those tunnels. It scratches the silk, causing scars and inflammation that eventually turn into a blockage. The American Diabetes Association has highlighted that these blood sugar jumps after eating are a direct contributor to cardiovascular events, even in people who aren't officially diabetic. Flip your breakfast. Stop the carb-first routine. Start your morning with high-quality protein and healthy fats, like 2 poached eggs or an avocado. This stabilizes your blood sugar and protects your silk-lined arteries from that shards of glass effect. I want to pause right here. We've covered a lot, and I have more critical signs to show you. But I need to know you're with me. If you've noticed any of these signs, the swollen ankles, the morning dizziness, or if you've been eating that healthy cereal every day, I want you to type yes in the comments right now. I read every single one of your comments. I do this because the medical system is failing you with 10-minute appointments, and this community is where we fight back. Type yes so I know you're taking control of your heart today. Another common thing I hear is, "It's just a little heartburn, doc. I probably shouldn't have had that spicy dinner last night." This is one of the most dangerous deceptions in medicine. Because the heart and the esophagus share the same nerve pathways, your brain often can't tell the difference between gastric acid and a lack of oxygen to the heart. Morning indigestion is frequently angina, the heart's way of screaming that it's not getting enough blood. Think of your body's nervous system like a complex switchboard in an old hotel. Sometimes, a call comes in from room 101, your heart. But the light on the switchboard flickers in room 102, your stomach. If you keep sending room service, like antacids, to the wrong room, the guest in room 101 is going to expire while you're busy at the wrong door. Statistics from the NIH show that women, in particular, are 50% more likely to be misdiagnosed during a heart event because their symptoms present as nausea or indigestion rather than chest pain. If you experience heartburn that doesn't change when you change positions, or if it's accompanied by a cold sweat, do not reach for the antacids. Take an aspirin test. If a 325 milligram aspirin relieves the indigestion within 15 minutes, it wasn't your stomach, it was your heart. See a cardiologist for a stress echo immediately. Many seniors tell me, "I'm just out of shape. I get a little winded going up the stairs to get the laundry in the morning." But that's just what happens when you hit 60. Being out of shape happens over years. If you find yourself suddenly more winded during your morning chores than you were 6 months ago, that is not age. It is pulmonary congestion. It means your heart is struggling to clear blood from your lungs, causing fluid to back up into the air sacs. You aren't out of breath. You are effectively drowning from the inside out. Imagine your lungs are like 2 dry sponges. They are light, airy, and easy to move. But when the heart fails to pump efficiently, those sponges start to soak up water. A wet sponge is heavy and hard to expand. When you walk up those stairs, your chest feels heavy because you're trying to breathe through soggy sponges. The Heart Failure Society of America notes that shortness of breath during activity is the single most common symptom that patients ignore for months before a major cardiac crisis. Use the staircase benchmark. Every morning, walk up one flight of stairs at a steady pace. If you cannot finish a sentence at the top without pausing for breath, your heart's pumping power needs to be checked by a professional. Finally, I hear about cold feet. My feet are always cold in the morning. I just have poor circulation. I've had it for years. I just put on thicker socks. Poor circulation isn't a diagnosis. It's a symptom of peripheral artery disease. If your feet are cold, pale, or have lost the hair on your toes, your arteries are becoming calcified. They are turning from flexible tubes into rigid pipes. This is a mirror of what is happening in your coronary arteries. If the pipes in your feet are clogged, the pipes in your heart are almost certainly clogged too. Imagine the pipes in your home during a deep freeze. The water at the very end of the line, the guest bathroom, freezes first. Your feet are the guest bathroom of your body. If the flow is restricted there, the whole system is in danger of a total freeze-up. The American Heart Association states that people with this condition have a much higher risk of heart attack or stroke. Check your capillary refill. Press down on your big toenail until it turns white. Let go. It should return to pink in less than 2 seconds. If it takes longer, your blood isn't reaching the guest bathroom. Start a 15-minute morning walk, even if it's just around your living room, to force those vessels to dilate. Now, I want to tell you something that might make some of my colleagues uncomfortable. Most of you go for your annual checkup. Your doctor listens to your heart for 30 seconds, checks your blood pressure, and says, "See you next year." This is not enough. A standard EKG only shows what your heart is doing at that exact second. It's like taking a 1-second video of a car engine and saying the car can drive 1,000 miles. If you have any of the signs I mentioned today, you must demand a CAC score. It is a simple 5-minute CT scan. It costs about $100, often less than a nice dinner out. It is the only way to see the actual rust inside your pipes before it causes a heart attack. Insurance companies often don't like to talk about it, but it is the test that saved George's life. George didn't die that day in the ICU. Because his wife recognized his morning indigestion for what it was, she got him to the hospital in time. We found a 95% blockage, the widowmaker. We cleared it, and George is back to his morning walks. But he doesn't eat the bran flakes anymore, and he does his thumb press test every single morning. You are the CEO of your own health, not your doctor, not the insurance company. You. Don't let just getting older be the excuse that costs you your golden years. If you woke up today with heavy ankles, a dizzy head, or heartburn, your body is talking to you. It's time you started listening. Drink 12 ounces of water before your coffee tomorrow. Do the 1-minute sit before you stand up. And please, for the sake of your heart, share this video with one friend who thinks they're just getting old. You might just save a life. I'm Dr. Arthur Hayes. Stay proactive, stay informed, and I'll see you in the next video.